At the Center of Excellence for Women's Health, we look closely at how healthcare providers and healthcare systems can be responsive to women's experiences of health issues, and how healthcare providers can best share information and support change as women make decisions about their health.
For over a decade, I've been studying trauma-informed approaches in collaboration with substance use service providers and health system planners. In this video, we'll walk through some resources we've created to support providers in using trauma-informed approaches, in this case, as they work with people who use methamphetamine.
We created these resources out of tremendous respect for the work of service providers, recognizing the challenges of their work in creating trauma-informed environments. With these resources, we hope that you can feel supported in applying trauma-informed approaches in your practice.
The first of the three resources we'll share, we've called a conversation starter, as it's designed to be used to support collective discussion by teams of providers who are delivering substance use services. So this one, Methamphetamine Use and Trauma-Informed Approaches, provides information about trauma-informed approaches and how they may apply, along with examples where organizations are already successfully doing this work. Trauma-informed practice is a way of working with service users that recognizes that most people accessing help for substance use problems have trauma histories, and that often people use substances to cope with these adverse experiences and may initially have seen their substance use as providing a benefit in managing their challenges.
Trauma-informed practice is not a therapeutic technique. Instead, it is a way of interacting with patients who use substances that considers that having trauma histories may mean that they have difficulty trusting service providers, may be easily overwhelmed, may not have had positive experiences in accessing healthcare previously, and may not have the skills that they need to manage emotions and make healthy decisions about making change.
Trauma-informed practice is a principle-based approach that considers these challenges and works to create safe and trustworthy environments for everyone, create service environments that provide opportunities for choice and collaboration and connection, and to create service environments that use strengths-based approaches that support a culture of learning together, not one where a service provider exerts power over in the relationship. Trauma-informed practice can be transformative and even potentially reparative to the traumatic experiences of a patient. It creates empathy and compassion and can become a way of working that's supportive for everyone. It does not require disclosure of trauma and instead looks for resilience.
The conversation starter goes on to describe and give concrete examples of how the trauma-informed principles can be applied to respond to people when they are overwhelmed neurobiologically during an interaction, so having an in-the-moment trauma response, share and teach a wide range of coping skills, support self-care and health-promoting activities, and tailor responses to groups of methamphetamine users. The conversation starter wraps up with reflection questions and links to manuals and guidance to further support the work of addiction service providers.
Some of our partners in the substance use field indicated it would be useful to have help with how the organizations who employ service providers, such as clinics and health authorities and treatment centers, could support their workers to apply trauma-informed principles and to stay healthy themselves. And this is a key aspect to trauma-informed practice, to put in place policies and approaches that support the wellness of those who work regularly with people who have trauma histories. So the second resource is an infographic about how leaders can facilitate the building of trauma-informed cultures in their organizations so that the service providers can, in turn, create trauma-informed environments with clients. We discussed with addiction service providers several web-based resources about trauma-informed practice at the organizational level. We adapted a resource entitled Key Ingredients for Successful Trauma-Informed Care Implementation and added in wisdom from other U.S. and Canadian organizations in order to make a trauma-informed organizational resource to fit the work of addiction service providers who are working with methamphetamine users in Canada. So, this infographic identifies 8 strategies that organizations can take to become trauma informed. And these strategies range from the first one about leading and communicating about being trauma informed to the sixth one down the list about supporting a healthy workforce. We've shared this resource with other service sectors who have found this helpful and supportive in guiding their work.
The third and final resource we will share is about mindfulness approaches. This is another example of a conversation starter for service providers to inform their work and to prompt discussions that can be held with one's coworkers about practice improvement. Learning about and practicing mindfulness is an element of being trauma informed. It is one of the skills that can be key for helping clients stay centered in the face of overwhelming emotions and for service providers to stay present in their interactions with service users and in their daily life overall. There is considerable evidence for mindfulness practice to support people in general, people with substance use problems, and specifically for people who use stimulants. The first page of the conversation starter describes mindfulness-based approaches that have been used and evaluated with methamphetamine users, and it links to podcasts that feature the developers of these evidence-informed programs. The second and third page of this conversation starter on mindfulness provides links to mindfulness approaches that have been tailored for specific groups of people with substance use concerns, including women and adolescents. It also includes links to handouts, worksheets, and guided meditations that can be shared with service users.
So, there are several other resources about trauma informed approaches on the Center of Excellence for Women's Health website to support service providers in their practices.
There are also additional conversation starters that focus on evidence-based approaches to working with those who use methamphetamine, including one about sex and gender-informed approaches.
We really appreciate the opportunity to contribute to closing the loop between research and practice and policy. We hope these resources support you as a service provider.